Spain is approaching 2 weeks of its stay-at-home restrictions and store closings, but its infections and deaths keep rising. Doctors, nurses and ambulance drivers in Spain's worst-hit regions are working non-stop and falling ill at an alarming rate.
I'm Julie Pace, Washington Bureau Chief for the Associated Press, and this is Ground Game. The coronavirus pandemic ranks among one of the most consequential stories ever covered by the Associated Press in its 170-year history. Here to take you inside the outbreak is AP's Ralph Russo.
From the Associated Press, this is Inside the Outbreak. I'm Ralph Russo. Today is Wednesday, April 1st. My guest today on Inside the Outbreak is AP reporter Aritz Parra, who is based in Madrid. Spain has had a massive spike in coronavirus deaths this week, with 864 recorded in one day. Officials are scrambling to respond as the country's healthcare system is being pushed to a breaking point. More than 13,000 healthcare workers have been infected in Spain. As of this recording, there have been more than 9,000 deaths in Spain, and what to do with the bodies is now becoming a challenge. As the number of cases soars in the United States and the president warns of six-figure death tolls, is this a forecast of what's coming here in the U.S.? Aritz Parra is an AP reporter based in Madrid. Thank you so much for joining me today, Aritz. I know you're very, very busy these days.
Thank you, and I'm very glad to be here with you.
So Spain is quickly becoming, it seems like, the hottest spot for the coronavirus outbreak in Europe. Let's just start with what's the latest there on the crisis.
Well, yes, indeed. We are actually the third country with most infections. And as you know, as you have been talking to many great reporters around the world, the figures are nothing that we can trust completely because it depends on many variables. And in Spain, particularly, authorities are not necessarily carrying out enough tests to figure out what's the extent of the outbreak. But what we have, that's the only thing that we can go with, is that we have over 100,000 cases. And that's very close to, we just surpassed China in terms of the number of infections. And it's very likely that if we continue this way, we might take over Italy as second country worst hit by the outbreak. And in terms of deaths, we have been pretty much recording more than 800 deaths per day for the past 5 days. Now, authorities here are saying that things are getting better, that the actual pace of the infections, of the contagion is declining, and that we are very likely to see infections peaking very soon. But one day things go up, one day things look better, and then the next day they start to look worse. So everybody's being very, very cautious about it.
So government responses to the outbreak are being scrutinized all over the world. What has been the early assessment of Spain's response to the coronavirus?
Well, there has been a lot of criticism to the government, and that has to do with the fact that Spain wasn't the first country that was badly hit in Europe. Spain had the experience of China and many countries in Asia to learn from, but especially Spain had the case and the experience of Italy dealing with the outbreak. Authorities here, the Spanish government says that they've been taking all measures gradually and listening to the advice of experts and the WHO. But one of the main points of criticism to the government has been the fact that just a few days before they announced the first lockdown, which was a partial lockdown, the government authorized big mass gatherings to mark the Women's Day on March 8th. This is a left-wing government that has a very strong feminist agenda, and the political opposition, especially conservative parties, have been criticizing the government for not taking those measures before in order not to alter the marches for Women's Day. That was perhaps an anecdote, but in general, the government is seen as pretty much responding late and pretty much improvising in many ways. We are hearing one thing one day, and then like a couple of days later, the government does exactly the opposite. That has been the target of quite a lot of criticism.
So there has been a lot of discussion, appropriately so, about hospitals being overwhelmed, being filled to capacity. But there are also concerns about what to do with the dead. What is being done in parts of Spain to deal with the bodies?
Well, yes. I mean, you touched so many things there. The main issues in Spain, I would say, I mean, there's so much, right? But the main issues that we have been paying attention to and that are a focus of concern are health workers, nursing homes, and as you said, also the managing of the death of that amount of bodies. And it's a grim situation, but we have more than 9,000 people who have died so far because of the virus or with the virus. Let's start with health workers and situation in hospitals. I mean, they are completely overburdened. It depends on the region because the outbreak is hitting regions of Spain that are suffering it more than others. So the occupation of ICUs and hospitals varies depending on which region we're talking about. And that, I believe, is something that happens all over the world. But the main sort of like concern in hospitals is also the fact that we have more than 13,000 medical workers infected. These are doctors, nurses, and all kinds of other hospital workers who are really needed to do their jobs at this point, and instead of that have to be home. And because we don't have enough test kits, a lot of them are going undetected for days or even weeks while they are infecting colleagues. And that's really one of the points where the government is being criticized a lot. You were talking about deaths. The number of deaths, particularly in areas like Madrid, the capital, and Barcelona, which is the second biggest city in the country, has made authorities having to like set up morgues in the case of Madrid in an ice skating rink and also in a former public building that had not been used for the past few years. So it's really a grim situation, and in nursing homes, which have been particularly badly hit, as it has happened as well, from what I know in the US and in other European countries. Part of the problem has been the fact that funeral houses are so overwhelmed that they don't have time to pick up the bodies from nursing homes. So we are seeing situations in which bodies have been left for a day or even 2 days in nursing homes while awaiting for an ambulance or for a funeral house to show up and take them away. And that's obviously a very, very sad situation to start with, grim, and also the health perspective is also not the ideal situation, of course.
That just sounds like such a bleak situation. Let me get back to the hospitals for a second, because there's now reports of field hospitals, and we're seeing this here in New York with field hospitals in parks and ballparks and athletic facilities. Where are the hospitals being built, and who is building them? And I guess the last part of that is, are they helping?
Yes, they are. I mean, in Spain, we're seeing them being built to start with in hotels, which is being very helpful in terms of. I mean, this is not building a hotel; it's taking a hotel that exists and because pretty much all hotels are closed at the moment. They are being medicalized. Like basically, rooms are being repurposed into hospital rooms. They are taking the patients that are in less serious conditions, and they are usually being taken care of by students or like medical students or medical workers who retired and have been recalled back to work, or doctors who are not necessarily involved in dealing with the coronavirus. So, but the idea behind that is that you take part of the load that we're seeing in hospitals and you take that to hotels so hospitals can focus on the most serious cases. Apart from that, there have been field hospitals sort of repurposed or built in sports facilities, in libraries, and especially in exhibition centers. And there's a big one with more than 1,000 beds in the outskirts of Madrid, in a big conference center where last year, I don't know if you remember, that's where they held the UN Climate Summit, so-called COP25. So that's a facility that now is hosting more than 1,000 beds. And including today, they just set up 16 intensive care units in that place. In that case, it was built sort of like put together by the regional authorities of Madrid and also the military. So the Spanish government has actually made use of the Spanish army, and especially a division which is called the Military Emergency Unit, to carry out a lot of this work in field hospitals and also disinfecting nursing homes, for example.
Last question for you, Aritz, and thank you again for doing this. Something a little more personal. And as a reporter, when did the enormity of this story sort of hit you?
Well, to be frank, I think this is something that until we see it right before our eyes, we don't realize how bad it is. And I think that's what has happened with most Spaniards and I think to reporters in general. We have been reading and seeing all the stories that were coming out of China and Italy. And even here in Spain, we started to see like the first sort of cases. And then it's not until you feel it closer to you, until somebody, a friend of yours or the father or mother of a friend of yours falls ill and is affected by this, that you see, oh wow, this is really serious. This could really change somebody's life overnight, right? So I have to say, even I think journalists, we probably have not awakened to the seriousness of it until we saw it before our eyes. So that was definitely the case with us. I mean, we were covering it very incrementally, but it wasn't until I would say like 2 weeks ago when we started to see how even the government was telling us you should be working from home, when we took it like really, really seriously and we started devoting pretty much 24 hours of our day to the story.
Aritz Parra is a AP reporter reporting from Madrid. Thank you so much again for working me into what I know is a busy time, Aritz, and please stay healthy and good luck.
Thank you so much, and same for you.
That's it for this episode of Ground Game. We'll be here every step of the way during this extraordinary moment in American politics and American life, giving you all the news you need to know. Be sure to tell a friend about us, and please subscribe on Apple Podcasts and leave us a review. Some of the details of our discussion may have changed by the time you hear this. For up-to-date developments on all of your news, head over to apnews.com. From the Westwood One Podcast Network.